All right, we're going to cover oral medication administration. Remember, with all things medical, ensure that you and the rest of your caregiving team are wearing proper PPE and taking universal precautions. When you prepare to administer oral medications, you will utilize the 6 patient rights and the system of 3 checks prior to actually administering any medication. The 6 patient rights are the right medication, the right dose, the right time, the right route of administration, the right patient, and the right documentation. The 3 checks are centered on the medication itself. The first check is when you remove the medication from the locked area and check the prescription label and compare this to the medication log to make sure that they match. The second check is made before you pour or prepare the medication by checking that the medication label and the medication order match. The third check is made by checking the prescription label against the medication log to make sure that they match. You do this before you administer any medication. Also, before you administer any medication, you check for the patient's drug allergies and make sure that there's no conflicts. As always, good patient care is centered on good communication between the caregiver and the patient. Make sure that you take the time to explain the procedure and what medication will be administered before you begin. Another good thing to remember is to have everything you might need readily accessible before you jump into action. Having to run off to gather some extra equipment makes you look poorly prepared, which does not boost your patient's comfort level. Here is the equipment that you will need for this evolution. You'll need a pill counter, the medication order, any fluid needed to assist with the consumption of the medication, basically water to wash the pill down, a pill knife, the unit dose of the medication, and then whatever form you're going to use for documentation, whether it's a SF510, SF600, or maybe even a DD792. When administering medications, you will be required to calculate dosages. And remember, medication dosages can be weight dependent, or they might also come in a variety of concentrations. This is also a good time to make sure that the medication you will be administering has not passed its expiration date. One of the 6 rights is to confirm that the medication is going to the right patient. Naval Hospital Bremerton requires that the caregiver reads the patient's armband or patient identification band, and then also confirms the patient's identity by asking the patient their name. If the patient is unable to answer, it is acceptable to ask a family member. Naval Hospital Bremerton's policy, and really the standard of care in any medical facility, is to use proper hand hygiene and then don non-sterile gloves when working with oral medications. For the practical portion of medication administration, you will be expected to properly count and distribute medications based on the unit dose. You will then administer the medication and ensure that it is swallowed completely. There won't be a Jeopardy, I know you guys are probably really bummed, but there won't be a Jeopardy game following this because there's really just not enough information to generate the 31 questions required for an adequate game. So we'll just move right on to the practical portion. So have fun with that. Take care.